Hello, good afternoon, everyone. Happy holidays. The holidays has just begun. Okay, I expect not many people will be following my lesson today, but it's all right. I just want to finish the syllabus, okay, because I'm continuing from what I left off, which is chapter 11 last week. So this week I'm just continuing with 11.3 and 11.4. All right. So not many people here, okay? I can expect that, but it's all right. Okay, so I think there's only one person here, but doesn't matter. All right, good evening or good afternoon, wherever you are. Okay, so I'm going to share screen now. I hope you can see this. All right, okay. So I'm continuing with 11.3, which is types of immunity. So besides knowing the three types of what you call the defenses, first line of defense, second line of defense, and third line of defense that we've seen in 11.1, that's important for chapter 11. This 11.3 is also equally important. We need to know the different types of immunity. Okay, actually there are 4 types of immunity. Okay, so I'll get right down to this. Let me continue with this. All right, so number 1, right? Now before that, right, this is the slide for my topic, 11.3. Okay, first of all, let's look at the types of immunity. Right, immunity can be classified to 2 basic types. Okay, so first we have active immunity and also passive immunity. So you need to know the classification, and you also need to understand why is it called active immunity and why is it called passive immunity. So there has to be a reason. Okay, the first thing is when you talk about active immunity, active means you're doing something. Okay, when someone calls you active, that means you're doing something. You're not just sitting around doing nothing. So active actually means active immunity is the type of immunity that someone gets if the lymphocytes or the white blood cells, the particular white blood cells, are producing antibodies. So if your lymphocytes are producing antibodies, the antibodies come from within your own body. This kind of immunity is known as active immunity. Okay, so this is clear. It's very easy to understand. If you're doing it, you're making the antibody, then it's considered a type of active immunity. The antibody comes from yourself. You're making it. Okay, for passive, it's the exact opposite. So if it's passive immunity, it means that you are not making it. Your body does not produce the antibody. Okay, that means the antibody is there, okay, but it is you get it from somewhere else. You don't get it from inside your body. You don't make it. Okay, so in other words, body receives the antibodies from external source, a source that is somewhere else. That is not, you did not do it yourself. You did not produce the antibody yourself. Okay, and then under active, there are actually 2 types. So now we further classify into 2. Actually, in all, there are 4 types of immunity. Active, then passive. And under active, there are 2, which is artificial, natural first, natural and artificial. Okay, so what is natural? We read it this way. Natural, then we go up, we call it active, and lastly, immunity. So now, the first type of immunity is known as natural active immunity. Okay, what does it mean by that? Natural means, something that's natural is not man-made, right? Something naturally happens, you fall sick, right? It's very natural for us to fall sick if our immunity is not strong enough. So natural active immunity is the type of immunity you get or your body gets when you get sick and you recover after that. So after you are sick, or rather during your infection or during when you're sick, your body will be actually making the antibodies to try to actually kill off the bacteria or the pathogen. All right, and then after that, when you're already cured, when you already recover from the disease, you have this antibody still inside your body, and that offers you immunity. That type of immunity is known as natural active immunity. Okay, so you have to be sick first before you get this type of immunity. Naturally, you fall naturally sick, okay, before you get this immunity. Okay, the second type. The second type is known as artificial active immunity. Okay, so we go up. Artificial, then the next word is active, and then last is immunity. So this type, second type of immunity here is artificial, right? Artificial means you do not get it naturally. You got to do something. Your body has to do something not natural, which is you purposely got an injection, which is actually, this injection is actually called vaccine, and it makes your body make the antibody. Okay, so artificial active immunity is the immunity that is acquired when an individual receives a vaccine injection. Okay, so actually vaccine is a suspension, or it is a substance that that contains pathogen or virus or bacteria that has already been weakened. So when you inject vaccine, the entry of this vaccine into your body will actually, because of antigen, right, it will trigger your body cells to produce the antibody. So you purposely want your body to produce the antibody before you get sick. So normally you take vaccination, or you take the vaccine when you are still healthy, because I want it as a prevention. I want to get the antibody first before I fall sick one day, maybe because of the actual or the real pathogen. Okay, so this is called artificial. You got to get yourself injected with this vaccine. Okay, next one. Now we go on to the passive. Okay, passive means, like we said, your body does not make the antibody. Your body does not make it at all. You have to get it from somewhere else. Okay, so the first one is natural. Natural passive immunity. Natural passive immunity. So something natural is like, we're talking about a baby, let's say, all right? The baby is in the mother's womb, and then the mother will be providing, or mother is actually making the antibody, and it crosses the placenta, it goes to the baby. So the baby also gets immunity because the mother makes the antibody. So in other words, the baby does not make the antibody, but still enjoys the benefit of having antibody. Okay, and another way where the baby can have this natural passive immunity is when the baby is born. So when the baby, after she is born or he is born, she might be breastfeeding, or she may be getting breast milk from the mother. The mother has got breast milk which is high in antibodies. So when the baby feeds from the mother, okay, breastfeeding, so she will get the antibody that is produced by the mother. So in either way, you find that the baby does not produce antibody. The baby got it from the mother, right? So that is natural passive immunity. And the last type of immunity is known as, okay, number 4, this is artificial. So you can see there are 2 types, artificial, and there are 2 that are natural. So artificial passive immunity. Okay, now this type of immunity is acquired, or you get it when you are given an injection, but this is not vaccine, it's a different thing. Okay, it is actually the antibody itself. So when you get this injection called anti-serum, it is actually a serum that contains antibodies. So somebody or something else has made it, they are injecting the antibody into the body. Okay, that is artificial passive immunity. So you can see for number 3 and number 4, the person does not make the antibody. All right, okay, so clear, right? I hope this is clear, so that you know the basic classification. Once you understand the classification, it will be easier for you to explain each type. Okay, so we go in detail. Okay, so for active immunity, antibodies are produced by the lymphocytes in the body. Remember, it's actually to be specific lymphocytes, not just to say white blood cells. Okay, if you're at Form 4 level, you're not in Form 2 level. Okay, in Form 2 level, you may be able, you can get away by saying white blood cells produce antibodies. Okay, but in Form 4, you have to be more specific. You have to mention it is a lymphocyte, not just white blood cell, because white blood cells you have monocytes, you have neutrophil, you have eosinophil, basophil, and so on. Okay, so next, passive. Antibodies are not produced in the body. It is obtained from external source. So this is actually one of the differences. We will see again later. All right. And next, another difference that is quite obvious is for active immunity, because your body makes it, the antibody itself, it will be long lasting. Okay, your antibody will be able to stay in the body and remain active for a longer time if we compare to the passive one, the passive immunity. For passive immunity, this antibody, even though it is in your body, but it's injected from outside source. So progressively, your body might be breaking down some of the antibodies, and it will only have a temporary effect. That means it will not last, the antibodies will not last as long as the active immunity. Okay, next one. Now let's look at the first one, natural active immunity. So this is acquired after an individual recovers from an infection. So there's no other ways about it. If you want to get this immunity, which is natural active immunity, you have to fall sick. You have to be infected. Okay, you fall sick, the virus enters your body, and your white blood cell is triggered to produce the antibody. After that, it will remain in your body, and you are protected for life. Usually, it takes the effect is long lasting. You might just, that's why there's certain, that explains some of the reasons why certain diseases you only get it once in your lifetime. Okay, so when somebody is infected by a pathogen, the lymphocytes will produce antibody as a response to these antigens. All right, and then when an individual recovers, so your body, as you are sick, right, you're making the antibodies itself. So when you the antigens have already, or the pathogen has already been killed or already died, or if the virus once is caused, then the antibody that it still remains in your body will give you a permanent immunity against the same disease. It only gives you the immunity to the same disease. Okay, antibodies reaction is very specific. So it cannot, we do not have a certain antibody that can have immunity, or it can protect you from all types of diseases. All right, so this is the structure of the antibody. This is a Y shape, okay, long chain and short chain. Okay, next, same, we're still talking about number 1. All right, so the lymphocytes, okay, the B, there are two types of lymphocytes, all right, B cells and T cells. So the B cell stores memories of pathogen. Memories, so once it's infected by a certain pathogen, these B cells will store information, okay, about this pathogen. In that case, if the same pathogen attacks you again, all right, the same pathogen, so these B cells will rapidly produce antibodies. It has the ability to produce the same antibody again once the antigen enters your body. You are attacked by the same pathogen again. All right, so it will produce antibodies very fast, and it's so fast that your antigen or the pathogen will not have a chance to inflict any kind of disease on you, because you already kill off the antigen immediately, very, very fast. Okay, once it enters, you already kill it off before it has a chance to harm your body cells. All right, okay, so that is how the concept goes. Okay, so examples of diseases that can offer you natural active immunity are chickenpox, rubella, and measles. Rubella is actually called German measles. Okay, so this one, once you get it once, that's why this is the reason why for these 3 diseases, usually it infects you once only. You get chickenpox once in your lifetime, because your B cells are still in your blood. It will be able to produce antibodies immediately once you're infected again by the same antigen. All right, okay, let's go to the second type. This is the artificial active immunity. Okay, this is where you purposely want to produce the antibody before you fall sick. So you've got to get something to trigger your body to produce the antibody. So this is acquired after an individual receives a vaccine injection. Okay, so you can walk into a clinic, actually, you can get any vaccine that you, not any, okay? Of course, there are certain ones that are fixed, that because they do not produce vaccine for every type of disease, right? It's not possible sometimes. So you find you can go in and then you can just pay. I say I want to get a vaccine injection for hepatitis B. Okay, so you'll be given the dose, right? So to protect oneself from a disease, so this is a protection before you fall sick. You do this first. An individual can be immunized. Immunize is another word for vaccination. That means immunize means to become immune. Okay, usually you can get vaccinated, or you can be you develop the disease by yourself lah, right? Means you fall sick. So be immunized means you get the immunity. Okay, so you see very often, right, we bring babies to the clinic, okay, when they are a few months old. We have to start the immunization at very young age, because we must offer them the protection. Because and when they are babies, they are very young, the cells are prone to attack by disease, by these pathogens. They do not have the immunity yet, so we have to give them the protection. Okay, so immunization is the process that produces immunity against a specific disease through vaccine injections. So immunization is just like vaccination. We purposely give the individual a protection. All right, so you have this needles here and vaccine. Now you will see this vaccine come in small bottles. Vaccines are usually suspension of pathogens. So they are not live pathogens. They are not the actual pathogens that make you sick. It's actually a pathogen has been processed. They are called weakened, or we call attenuated, or they are non-virulent. That means they are not able to give you the disease. Okay, they have been processed so that they do not give you the disease. But you need the antigen on the surface of this pathogen in order to induce or trigger your lymphocytes to produce the antibody. So that's why you need the pathogen. Even though the pathogen, okay, it's already dead, what you need is actually the antigen. Okay, next. Still on the same thing, number 2. So when a vaccine is injected into the body, the vaccine will stimulate lymphocytes to produce antibodies. Usually, right, normally you may need more than one. The first dose of the injection, right, will result in a low level of antibody production. So sometimes, because it takes time, when you want to produce the antibodies, your body requires time to produce it. So you will not get an immediate spike. You do not get an immediate increase in the value or the amount of antibody that is enough to protect. So it slowly rises. Later on, I will show you the graph. Okay, it slowly rises. So you do not say that the next day you will have full protection after getting the vaccination. It doesn't work that fast. You will take at least maybe a few more days, or perhaps up to a week and so before the level reaches to a certain level. But sometimes it does not go up that fast. You need to get another injection, which is called a booster dose. A booster dose will be given, must be given usually, sometimes that's very rare you have a vaccination or vaccine which needs only one injection. Most of them requires 2 or 3 doses. Okay, so a booster dose must be given to increase. Okay, so when you answer question, you got to write it in this way, so you get the correct you get the marks for it. You cannot just simply write in any way that you want and you don't have the keyword there. It's given to increase the antibody production to a level of immunity that can protect the individual from a disease. It has to be a certain level or the concentration of the antibody in the blood before you're considered you're protected. All right. Okay. So now some more examples of vaccines. So you have BCG. Okay. Now last time we used to have BCG. I think now we do not have the BCG vaccination anymore. Okay. Not my children also do not get it. It's been taken off, I think, in the immunization calendar of the Malaysian health department. All right. So the KKM. So BCG is for tuberculosis. Okay, you call it batuk kering in BM. You have a scarring there. Okay, then HPV vaccine. This is to prevent cervical cancer. okay, to prevent cervical. It's human papilloma virus. Then polio vaccine. This is to prevent poliomyelitis. Okay, it is a disease that can affect the nervous system. So usually young children or babies, once he or she is infected with polio, they are likely to be paralyzed for the entire life. They cannot be walking already. So there are two types of vaccine here. One is Salk vaccine, one is Sabine vaccine, developed by different scientists. Salk vaccine is to be injected. Sabine vaccine is this one. I'm sure. I think you don't remember, but I remember giving my children, bringing to the hospital, and they gave a certain kind of a drop. It's a red color or pink color drop into the mouth of the baby. That actually contains, that is actually vaccine. It's called Sabine vaccine for polio. Okay, next one, MMR. MMR stands for measles, mumps, and rubella. So there are three diseases that it protects, this kind of vaccine. Okay, measles, mumps, and rubella. And one more, DPT. Okay, I also got DPT. My children got DPT, which is diphtheria, pertussis, and tetanus. Diphtheria is one of the symptoms is your throat here. There's white spots in your throat. Okay, pertussis is called whooping cough, a kind of cough, which is gives you a kind of a very quite severe kind of coughing. Tetanus, okay, tetanus that you get that gives you locked jaw. Okay, next. Third one, natural passive immunity. So this one is acquired through breastfeeding. Okay, this one I mentioned earlier. Breastfeeding and from mother to fetus during pregnancy. So it's either during pregnancy or after the baby is born during breastfeeding. Okay, so in either way, the baby does not produce this antibody. So acquired by a fetus when the mother's antibody diffuses through the placenta into the blood flow of the fetus. So the baby gets the antibody directly from the mother through the placenta. Of course, also through the umbilical cord, right? Like here. Okay. And the antibodies are also found in the mother's milk or colostrum. Colostrum is the milk that contains higher contents of antibodies. So when breastfeeding, so the antibodies will protect the baby for the first few months after birth. Okay, so it's encouraged to give breast milk to the baby. Okay, not to waste it and throw it away. All right. Okay, artificial passive immunity. So this is getting this another kind of injection. But this injection is called anti-serum, not vaccine. So please use the word properly. Injection is anti-serum. So usually, what is an anti-serum? It means serum that contains antibody. So you combine the two words, you get anti-serum. Okay, serum is from the plasma, which is the plasma of the blood minus fibrinogen. Okay, so minus the clotting factor, which is the fibrinogen. Okay, anti-serum gives immediate but temporary protection. It's not long lasting because your body did not produce it. So its antibody is produced or it's received from outside source. So your body will probably be breaking down, okay, your system, right? Be breaking down these molecules. So it's not long lasting. And examples would be anti-tetanus toxoid, okay, that gives you locked jaw if you don't have this anti-serum. Rabies anti-serum, this is if you get bitten by a mad dog, right? You get that the dog has rabies, you will get rabies as well. The anti-serum for spider bites and snake bites. So in both cases, in all these cases, you need immediate protection. You need to have anti-serum to sort of like neutralize the toxin in the spider bite or the snake bite. If you were to take a vaccine, it will not work because vaccine requires a longer time for your body to produce the antibody. So you need immediate. That's why you need to put in the anti-serum injection. Okay, so you'll see sometimes we use horses, okay, and this time how do you get the horse to produce this anti-serum? So first of all, you need to inject this tetanus toxoid, that means this pathogen of tetanus, into the blood into the body of the horse, and you're making use of the horse to produce the antibody for you. So you let the horse produce the antibody, you take out the blood, you separate the red blood cells and so on, okay, and then you have this serum, you take out the fibrinogen, you get the serum, and then this serum contains antibodies, and that is what we call the anti-serum, and that is injected into human once the person gets maybe cut by what you call these rusty nail and so on, okay, because that is where you have this possible infection from tetanus. Okay, next. Now another question that they can ask you in this chapter is comparing the two types of immunities. Okay, it could be active, it could be passive, it could be artificial, it could be natural. But here I'm comparing the artificial active immunity, meaning vaccination, giving vaccine, and artificial passive immunity, that means giving anti-serum. So what is the similarities and differences? Remember to write similarities as well. So it's always compare and contrast, including similarities also, not just the differences. Okay, so similarities protects the body from infectious diseases. Both are able to give you protection, and both involve interaction between antibodies and antigen. Okay, so these are the similarities. Usually there'll be less. Differences, we can look at a few aspects. Through what? How do you get these two types of immunity? So acquired through, for the artificial is through vaccine injection. For the other one is anti-serum injection. Okay, what is injected? Secondly, so here you have been injected a suspension of pathogens which are weakened or attenuated, dead or non-virulent. As for the anti-serum, what is injected is actually the antibodies itself. It is a serum that contains antibody, not making your body make the antibody, but we are giving the antibody directly into your body. Okay, purpose. Why do you want to get vaccinated? It is for prevention of specific diseases in the future. And for artificial passive immunity, it is perhaps you need to treat the disease. For example, you've been bitten by the poisonous snake, bitten by spider, or you step on a rusty nail. So this is for treatment, not so much for protection, but you can also use it as protection when immediate protection is required. For example, let me give you, you can get anti-serum, all right, if you, let's say you need to go overseas to maybe a country that is not very hygienic, you're afraid you'll be infected by certain things like typhoid and all that, you can get your anti-serum injection first before you go. But bear in mind, if you're there, you may need to, if you stay there for a longer time, you have to be continuously getting this anti-serum because they do not last long. Okay, probably a few weeks, at most 1 month or so. Okay, then next, effect. How is the effect? Okay, for this vaccination, it does not give immediate protection. It requires time because your lymphocytes are making the antibody. Okay, next. This one for the anti-serum, it gives you immediate protection because the antibody is given directly into your body. That is antibody. Immunity period for vaccination is a longer period of time, can last. But for this one, immunity anti-serum is temporary, does not last. When is injection given? Before being infected for vaccination. We normally take it as a prevention measure. And for the other one, anti-serum is given when in advance, when you fear that you may get infected. For example, like I said, you want to go overseas for a country that you are not too sure that the sanitation is very good. So you want to prevent the infection, you have a high risk of infection, or after being infected, you can also either way. Okay, then if you have been bitten by a snake, that is means after being infected by the disease, you need to get your anti-serum. Antibody. Okay, so the antibody, where do you get an antibody? For vaccination, the antibodies are produced by the lymphocytes themselves in your body. For the other one, it is not produced by your lymphocytes. It is obtained from anti-serums from an external source. Okay, maybe from the horse who did it for you, who made it for you. Okay, lastly for this 11.3, look at the graph. Okay, the need to give a second injection, that means the booster dose. So both may need booster doses. So for the first one, recognize the shape of the graph. This is important. The questions have been given before. They just show you the shape of the graph. And they are supposed to, you are supposed to identify the type of immunity based on the shape of that, what they call the graph. Okay. So if you find there are two mountains here, okay, we call it two mountains, right? So you have one here, it goes up and then it comes down again and it goes up again, especially after you give another injection. Okay, so this type is vaccination. You need to give another injection to increase the concentration. So above this dotted line here, this is the level of immunity, or the level that the minimum amount of antibody that is needed before you're considered you have protection. So you have to go past this level. Okay, so that's why you need a second injection. And for this one, the anti-serum injection. When you first give the anti-serum, you notice that it goes up directly straight. Okay, immediately. There is no lag in time. So here for this first one, we find that it goes up slowly and it comes down afterwards. But this one, it goes directly up. Okay, that means there is no lag. Because, right, the reason is because you immediately receive the antibody. What is injected in your body is actually the antibody. So therefore, it goes up. Immediately, you already achieve the level of immunity here. Okay, but then again, because it doesn't last long, after a few days, okay, perhaps a few days, it will drop. So when it drops, you find that it may drop lower than the level of immunity. Then you will need a second injection to increase back this level of immunity, the concentration or the antibody level, so that you can get protection. You are considered enough. All right, the concentration is high enough for you to be protected. Okay, so recognize the shape and you will know that this is, first one is vaccination, okay, with like this shape. And this one is directly up and then it falls and it goes up and falls and it may repeat itself. So this is anti-serum. All right, okay, next. Now we go to the last part. So health issues related to immunity. This is a specific reference to AIDS. The disease is called AIDS. Okay, so let's look at AIDS. AIDS stands for, I think everybody knows it, acquired immunodeficiency syndrome. So this is actually the name of the disease. A lot of people get confused. Do I call it AIDS or do I call it HIV? Okay, what is the difference? HIV is the name of the virus. Okay, it's not the name of the disease. So when you say HIV, you're referring to the virus that attacks the human system and weakens the human system. And the disease that the person gets after being attacked by this HIV is called AIDS. So this is the name of the disease. So do not mix up. Okay, HIV is virus name. AIDS is the name of the disease. Acquired immunodeficiency syndrome. Okay, next. So an AIDS patient can easily be infected by other diseases. So why do people actually die of AIDS? Okay, it's not because they die of AIDS. It's because their immune system has become so weak that they are infected with other diseases and they possibly died because of the other diseases. It is not really the AIDS that made them that killed them. It's because pneumonia, it could be other infection, okay, that killed the person. So the immune system is progressively being destroyed by this HIV virus. So HIV destroys the lymphocyte of the infected person. All right, so this is how AIDS kills you. So look at the symptoms of HIV. You have severe headaches, swollen lymph nodes, ulcers in the mouth, enlargement of the liver, muscle aches, joint pain, nausea, vomiting, diarrhea. All this could be going on for many, many months, and body rash. And these are the symptoms of HIV infection. But unfortunately, some people, in fact, not many people who are already infected by HIV, they do not know it because it takes many, many years for someone to show or to the symptoms to manifest itself, for someone to realize that they have the symptoms. And once they realize the symptoms, they actually have been infected for some time ago. So usually it takes about 8 to 10 years. Okay, the symptoms will come after 8 to 10 years. So imagine they've been infected for so long and you don't really know it. Okay, and the person can be easily infected by diseases, other diseases like I mentioned, pneumonia, okay, due to weak immune system. It could be a lung infection. It could be something else that will not kill other people, but it will kill someone who has AIDS. All right, okay, finally the immune system will be paralyzed and the patient will die from other infections. So you see, it's other infections that kills the person, not the AIDS itself. Okay, how is HIV transmitted? Okay, how do you get HIV? So there are a few methods. One is through bodily fluids or body fluids, like it can enter through blood. This is body fluids, the semen, okay, or across the placenta. Okay, so especially from mother to baby, right? So if the mother is an HIV, mother is infected by HIV or she has AIDS, the baby can also get it from the mother. Okay, so HIV can transfer the baby, mother can transfer the virus to the baby through pregnancy, birth, or even breastfeeding. Okay, other methods of transmission through unprotected sexual intercourse. Okay, of course, this is bodily fluids like semen and so on. Okay, vaginal secretions. Then sharing needles, contaminated needles. Needles are supposed to be used one. These are called hypodermic needles. They go under the skin, okay, and they can be puncturing the this whatever blood vessels or the capillaries under the skin. So once it's been used, it should be thrown away. Okay, it should be properly disposed of. But drug addicts do not have the means to buy needles every time, so they will share the needles during drug taking, and also through tattooing. Tattooing, there are needles that delivers the ink under the skin. Okay, that will be poking your skin. And if there are virus, okay, if a person who has HIV infection, if you use your needle who has been you have tattooed on that person and you tattoo another person, then the second person will be infected. Okay, so drug taking, tattooing, and also of course through HIV infected blood transfusion. So when you want to donate blood now, one of the things that they screen afterwards, after you donate your blood, is this HIV virus. So if once it is detected, the whole entire bag will be disposed of. Okay, so this is how HIV is transmitted. All right, okay, transmitted from people to people. Okay, so this is all the lesson I have for you today. So thank you for joining, and I hope to see you another time. Okay, so happy holidays, everyone. I hope that you enjoy your holidays, but make sure that you do study and learn up what you're supposed to learn. Remember, Form 4 syllabus is not finished yet. All right, so hope to see you another time. All right, thank you very much, and you can share the link to your friends. Happy holidays, and I'll see you in my next lesson, hopefully. Okay, bye-bye, everyone. Thank you.